All right, so we have an 81-year-old man with a history of atrial fibrillation who presents with abdominal pain. He fell 2 weeks ago and was advised to stop his anticoagulation medication after the fall. He reports diffuse, severe abdominal pain, but is minimally tender on examination. He has symmetric pulses in his extremities. What is the most likely anatomic location of his pathology? And we have answer choices A, aortic bifurcation, B, celiac trunk, C, inferior mesenteric artery, and D, superior mesenteric artery. So this is a second order question. We first need to make the diagnosis, and from that diagnosis, we need to understand which vessel or which part of a vessel is leading to this individual's presentation. So this is a great question, and it shows an understanding of pathophysiology and anatomy. And let's just go over and dissect the question itself. And if we start by looking, we have an older gentleman who has a fib and he's off of his anticoagulation. So anytime I see this in a question, someone stops anticoagulation, and not just in a question, but in actual clinical practice. If someone's supposed to be on anticoagulation and they stop, then they become prone to thrombosis. So that's what I'm thinking about just from reading this one line here. And let's look at a few other really important areas. One, he presents with abdominal pain. And what's interesting is his abdominal pain shows minimal tenderness. And anytime I see diffuse or severe abdominal pain without tenderness, right, that's pain out of proportion to exam. So that always makes me think some type of visceral or some type of ischemic process that may be happening in the intestines, for example. Okay, and the last part of this that's going to be very important is he has symmetric pulses in his extremities. So knowing all of this, let's go and answer the question, which is the most likely anatomic location of his pathology. Okay, so one, what does this patient have? What's the diagnosis? So he is prothrombotic at this stage because he's off anticoagulation, and now he has abdominal pain out of proportion to exam. This sounds like he has an intestinal or some type of ischemia due to a thrombosis in the mesentery. Okay, so our answer choices, one of these four answer choices are the anatomical location. Let's go through them. First, we have aortic bifurcation. Now, the aortic bifurcation, you can see thrombosis there, but it's a pretty wide caliber area. And if you clotted off the aortic bifurcation, you're going to get probably decreased or absent pulses in the extremities. So we do not see that. He had symmetric pulses, so I'm going to cross off aortic bifurcation. And then we're left with all of the branches that go in order here, right? So we have celiac trunk, then superior mesenteric artery, then inferior mesenteric artery. And these supply a lot of the abdominal viscera, the duodenum, the colon. And so which one of these is going to be the right answer? So first of all, let's look at celiac trunk. The celiac trunk is the first branch of the aorta, and it supplies the gut, but mainly the distal esophagus and duodenum here. So could this possibly be the answer? Maybe. So let's kind of keep that here. And then we have the inferior mesenteric artery, which is going to be in line here. It's going to come after the SMA. So it's the third in line of these branches. And it arises about 6 to 7 centimeters past the SMA, and it supplies the distal third of the transverse colon to the rectum. So it's possible that this is causing it as well. But now let's look at the superior mesenteric artery. And we know that the SMA, it's the largest caliber of these vessels, and it has a narrow takeoff angle from the aorta. Okay, so it's the most likely path for clots to travel to. All right, so the most likely anatomic location here. Now remember, it's not the only anatomic location. It is the most likely anatomic location is going to be the superior mesenteric artery. So let's cross off celiac trunk, let's cross off inferior mesenteric artery, and let's go with the SMA, which also supplies, most of the time you'll get ischemic changes in the jejunum. And the reason why you get this is because it has the least amount of collateral circulation. All right, so SMA, answer choice D. And sure enough, that is correct. Hey everyone, before you go, if you're interested in your own QBank, whether you are an MD or DO, a PA, or an MP, simply go to roshreview.com and sign up for a free trial. See if Rosh Review's content is right for you. Keep learning, keep working hard, and always have a sense of mission about your work. Now is your time. This is Dr. Adam Rosh signing off.